Top 10 foods to unclog arteries naturally and prevent heart attack. In this video, I will provide crucial information to help you make informed choices that can prevent the terrible consequences of blocked arteries. The best foods to prevent and potentially unclog the arteries are the ones that interfere with the plaque buildup in arterial walls. For that reason, understanding the mechanisms behind the formation of atherosclerotic plaque and its components is the key. Let's begin now. Arterial blockage occurs due to the accumulation of plaque in the artery walls, a condition known as atherosclerosis. It narrows the blood flow and can lead to many problems, including heart disease and stroke. How the plaque is formed. A plaque is formed when the inner layer of an artery does not remain smooth anymore and becomes rough and damaged. This is caused by oxidation, inflammation, or lesions which can be in the form of micro tears, scrapes, or cuts. The plaque then acts as a band-aid over that damage. It narrows the lumen of the artery and sometimes can even block it. Risk factors for plaque formation. This damage is linked to elevated stress levels, consumption of trans fats, high sugar and carbohydrate diets, omega-6 fatty acids, and alcohol. The damage is compounded by high blood pressure, lack of exercise, smoking, obesity, diabetes, family history, excess of small dense LDL cholesterol and triglycerides, a genetic predisposition for heart disease, and a hypercoagulability state, an increased tendency to form blood clots. Components of a plaque. The plaque is a combination of many substances including fats, cholesterol, protein, calcium, platelets, and even colonies of microbes called biofilms. These biofilms create protective calcium shells within the plaque. Studies show that these microbes enter the bloodstream through bleeding or infected gums, and even gut lining. They can end up in arterial plaque and heart valves through a process called bacterial translocation, and cause damage to blood vessels and infection of the heart valves. Now let us start with the foods that hit the process of plaque formation at different levels, and can even reduce the number and size of plaques inside the arteries. 1. Edible allium vegetables. Garlic, leek, shallot, ginger, chives, and onion are allium-type vegetables that have blood-thinning and anti-inflammatory properties. They also regulate the small dense LDL cholesterol. Garlic is great for the heart. It can thin the blood, lower blood pressure, and has antimicrobial and antibiofilm properties. It is especially helpful for those at high risk of clotting. 2. Cruciferous vegetables. Cruciferous vegetables help to get rid of atherosclerotic plaque through multiple approaches. They contain a compound called DIM, which can prevent biofilm formation. Crucifers help with bile production, which is required for the absorption of fat-soluble vitamins including vitamin E and K2, both of which are very important for cardiovascular health. They help to lower blood glucose levels. They are high in fiber, which feeds beneficial gut bacteria important for cardiovascular health. These vegetables are also loaded with potassium, which is helpful to keep the arteries relaxed and regulate blood pressure. Research has indicated that inadequate consumption of potassium is linked to elevated blood pressure and a greater risk of stroke. Cruciferous vegetables include Brussels sprouts, arugula, broccoli, bok choy, cabbage, and cauliflower. Health tips. People with hypothyroidism should not go overboard with cruciferous vegetables, and better eat them cooked. 3. Foods high in vitamin C. Vitamin C supports the immune system and strengthens blood vessels and gut lining to prevent bacterial translocation. Vitamin C also helps vitamin E, a heart-healthy vitamin, work better. Foods high in vitamin C include bell peppers, tomatoes, lemons, broccoli, kiwi, and strawberries. 5. Nitric oxide boosters. Nitric oxide can relax and dilate the arteries. That results in less pressure, which means less damage to arterial walls and prevention of plaque formation. Beets contain nitrates, which convert into nitric oxide. L-citrulline is an amino acid that can boost nitric oxide levels. It is available in supplement form. Ginkgo biloba is also known to have a similar effect. 6. Vitamin K2-rich foods. It is very important to control calcium buildup in soft tissues and keep calcium out of blood vessels. Foods that are high in vitamin K2 are fermented vegetables, natto, grass-fed butter, hard cheeses such as Parmigiano and Gouda, yogurt, kefir, egg yolks, and chicken liver. Beef and chicken also contain K2 and K7 in smaller amounts. Yogurt, kefir, and hard cheese are also rich in probiotics that support gut health. 7. Foods containing vitamin E. Vitamin E protects the inner lining of blood vessels from damage and reduces inflammation. Without enough vitamin E, oxidation and inflammation can cause irregularities in arterial walls, resulting in plaque formation. Vitamin E also maintains high levels of oxygen in the heart muscles and prevents heart attacks. Foods high in vitamin E include nuts and seeds, leafy greens, pumpkin, olive oil and wheat germ oil. Use olive oil as a salad dressing, or in place of other oils when cooking. 8. Probiotics. Probiotics are a promising therapy to prevent and treat atherosclerosis according to the latest research. Probiotics have a positive effect on several risk factors for atherosclerosis, including the healthy gut microbiome, cholesterol regulation, and inflammation. There is a strong connection between a healthy heart and a healthy gut which has the appropriate microorganisms. Probiotic-rich foods are apple cider vinegar, kefir, sauerkraut, cultured buttermilk, paneer, kombucha, yogurt, kimchi, natto, and fermented vegetables. 9. Foods high in omega-3 fatty acids. To prevent lesions in the arteries, it is important to maintain a low intake of omega-6 and a high intake of omega-3 fatty acids. They support both the arteries and the heart muscle and lower inflammation and blood pressure. Foods high in omega-3 fatty acids are mainly from marine sources like wild-caught salmon, mackerel, sardines, marine microalgae, and anchovies. Cod liver oil and krill oil are a concentrated source of omega-3 fatty acids. Health tip for vegans. The human body can only use EPA and DHA. Omega-3s from marine sources contain EPA and DHA directly. Plant-based sources like flax seeds, chia seeds, hemp, and walnuts have omega-3s in the form of alpha-linolenic acid, which the body must convert into EPA and DHA. However, the body is very limited and inefficient in this conversion process. For vegans and vegetarians, ditch the fish and go green. Algae oil provides a fantastic way to get you the much-needed dose of EPA and DHA, without relying on animal sources. 10. Polyphenols. Polyphenols help regulate bad cholesterol, blood sugar, and blood pressure while keeping the arteries clear. Additionally, they do not cause a spike in blood sugar levels. Foods rich in polyphenols are green tea, dark chocolate, and berries. 11. Fiber. Dietary fiber, both soluble and insoluble, has amazing health effects. It can reduce the risk of plaque formation, improve lipoprotein profile, and lower the risk of cardiovascular disease. Not only that, but it has no caloric value. It also feeds the gut microbiome. Leafy greens, flax seeds, chia seeds, avocados, and mushrooms are among the best sources of fiber. Lifestyle modifications for cardiovascular health. It is not just about what to eat but is also important to know what to avoid to prevent and reverse arterial blockage. It is necessary to minimize the intake of sugar, carbohydrates, alcohol, and omega-6 fatty acids found in certain vegetable or seed oils, margarine, junk, processed, and deep-fried foods. It is also crucial to control the major risk factors such as high blood pressure, diabetes, elevated levels of small dense LDL and triglycerides, and hypercoagulability. Incorporate a moderate intensity exercise for 30 minutes, 5 days a week. Some key steps towards improving your cardiovascular health are to lower BMI. Quit smoking. Manage stress levels. And get enough restful sleep. Maintaining good oral hygiene and visiting the dentist regularly are essential as well. A note of caution. It is imperative to take your doctor and nutritionist on board as some foods can interact with certain medications if you are taking them already. Natural remedies may not be enough for some patients, who may need certain medications or medical procedures. The ideal approach is to have an integrative healthcare plan that includes both natural remedies and medical interventions as needed. Let me know in the comments if you are interested in recipes with heart-healthy foods. Do you know that up to 50% of seniors die within 6 months of this condition? And no, I am not talking about heart attack. What could it be? Stay tuned and watch the video popping up on your screen to find out.